So we got our co-host.
Amazing.
Everything, I've got my fingers crossed today for everything. Okay, so
so far so good.
Okay, so here we go. So I am going to let me get that PowerPoint back up for you, and I'll let you guys kick this off. Just feel free to say, Steve, help at any point during our journey today, and take it away, Cathy and Kate.
All right, great. So welcome everyone. Like I said, this is new technology for all of us, but it's pretty impressive once you start working with it. But I want to thank all of you for being here today. This just gives you a little bit of the agenda for today. We're going to give a talk on our senior health department, a little bit on our new population health program, and then case management. We also have other Virginia VHC Health departments here in attendance. So we have representatives from our trauma program. For those of you who are not aware, within the past year, VHC has been designated as a level 1 trauma center. So we have representatives from our trauma center here to talk to you about what that means and the benefit for our community. We also have someone from our outpatient pharmacy. We have a lot of great programs through our outpatient pharmacy that are available for both people. So I think it's good to learn about that. We have folks from our outpatient rehab, and then a representative from patient experience. So they're just going to give a brief introduction so you can put a name to a face, and then the resource fair will open up after that, where you can move around. Go ahead, next slide. So I just want to give you an overview for those of you who may not be familiar. So recently in the fall of 2021, Virginia Hospital Center started a new population health division. So when that occurred, the senior health department and the health promotion department moved under our population health division. So we're really excited about that. Our mission really is to create opportunities for individuals to thrive as they age, whether they're in the hospital or out in the community. Our priority is each person's safety, comfort, and well-being. And our programs and services are really designed to promote healthy living for adults. Within the senior health department is myself, who I'm the director. I've been at the hospital for over 30 years now. Hard to believe. Kate, who you're going to hear about next, she's our manager of senior health. Blanca is our assistant manager. And then we also have an admin, Stephanie Gillum, who helps us with a lot of the administrative stuff. So I'm going to pass it on to Kate, and she's going to go into more detail about some of the programs that we offer through the senior health department.
Excellent. Thank you, Cathy. There we go, Steve. Thank you. So yes, nice to see everyone virtually. But in keeping with those goals, the mission of our hospital and the goals that Cathy described for our senior health department, we have several ongoing community health and wellness programs. And I just want to touch on them briefly, but I do encourage you to come to our table and learn more about each one. But to begin, we have 2 webinar type series. We have the Healthy Aging Lecture Series, which is a monthly program, a monthly discussion with an expert in the field. We often pull a lot of VHC clinicians or staff. We also pull just community resources and experts that we know in the field on different topics. And again, that's once a month. this coming July, just to put in a little plug, we'll be having a GI provider talk about digestive health as one example of the type of program that is. We also started a new program called Healthy Aging Capsule, and it's kind of a spinoff of the lecture, but it's more of a series, and we do it around some sort of theme or topic that we can kind of tease apart each week. We keep those short, 30 minutes, and over a series of 3 to 4 weeks, roughly, depending on the topic. So we're going to be starting a new one in July, focused on foot health. So hope you can join for that as well. We also are big proponent of promoting physical activity and for our older adults in the community. So our Walk Fit is an excellent way to get people out on a weekly basis. And it's also a great program for social connections. We have people that are part of this program that have been coming for years, like literally 10, 15 years. And it's a great way for them to come to a climate controlled environment. We do it at 2 local malls in the area on Tuesdays and Thursdays. They walk, they are able to now do some more socializing. And we also have a guided stretch that is part of every walk, the last 15 minutes of every walk that Blanca leads for them. And in addition, this is a fantastic way. We really appreciate all the partners in the community that support us through this program by coming and offering free blood pressure screening. It's a great way for them to interact with the walkers, and it's a great service that they provide. So it's a win-win. We also provide an ongoing support group. I co-facilitate the support group, and it's for individuals who are caring for somebody with dementia. And we welcome anyone to the group. We've been able to offer it now, both remote and, or I should say virtually and in person simultaneously. We've figured that out and able to get over that hurdle, but it seems to be going pretty well. So that's on a monthly basis, third Wednesday of the month. And then finally, let me just look at the screen here. Yes, we always welcome the opportunity to work with community groups and to provide in-person presentations or screenings or themed events. For example, we're kind of putting plans in place for a September fall prevention event. So we love doing that kind of thing. And now that we're able to get back out more, we really welcome the opportunity to work with others. I also want to touch on a program that's very near and dear to all of us, and that's the Lifeline Service. And we love this program because we see firsthand how it really helps people and really makes a difference in individuals' lives. I'm sure many of you, you're well versed in what a Lifeline Service does, where they're able to get access to care at the push of a button 24 hours a day. But I want to stress what makes it unique coming from us is we're the only hospital provider in the area that does provide this type of service. And we serve all of Northern Virginia, including some parts of DC. And we, the staff, literally the staff that Cathy introduced at the beginning, we're the ones going out to help each person get their unit set up, show them how it works, provide any maintenance they might need. So through that, we're able to really build that familiarity with each of the individuals, and they come to trust us and feel comfortable with us coming in their home. So it's a great way to just make sure, again, that we're promoting our mission of making sure people are safe in their homes, living comfortably, and also have that peace of mind that they have some backup if they need help. And let me just mention before you move on, Steve, if any of you are working with a client that wants this service, we do have an opportunity to list organizations as third-party notify, which can be very helpful if you're actually working with the individual as well. Whoops. Anyway.
I didn't know if I was going to bring James on for population health.
Let me just do this safe transition program, Steve, and then we'll be done.
Got it.
And then
there you go.
So I'll just keep going. To be honest, there we our safe transition program. Just want to mention it to everyone. It's part of our Lifeline, but it's for anyone coming out of our hospital that are they can receive that Lifeline service at no charge to the patient for 2 months for free. And that's just our way to make sure that they safely, return to their home and have that backup service that they need. So just want to make sure everybody's aware of that in case you're working with anyone just coming out of our VHC. We're happy to help them with that program. So, and again, please visit us. We can answer more questions and get into a little more detail. But now, Steve, feel free to pull up James and Hannah to talk through population
Let me
health.
stop sharing there briefly. Let me go over and welcome James Meenan to the stage. Whoops. Okay, let me do it this way, James. Okay. Oh boy. I'm so used to Zoom. It's like I love this platform, but it's has a few little fun things. So James, I'm trying to welcome you to the stage. You actually, James, if you turn on your mic and camera, I'm wondering. There we go. Okay, excellent. Okay. All right, folks, buckle up. Here we go. And I've got your slide deck, James. And some of you may remember James at the last discussion we did as being the director of case management, correct, James?
Yeah, I think that was at Carlin Springs, Steve.
Mm-hmm.
Yep, I recall that. Yeah, I've been at VHC Health now for about 16 years, and most of that time's been spent in case management. And as Cathy alluded to earlier last fall, we brought to hospital leadership the opportunity of creating a population health division, and that was warmly received. And so what that means at Virginia Hospital Center, because population health programs can differ from organizations and regions, is that we're looking at the specific disease populations and how we can better serve those populations. And so this slide I brought up, National Institute of Health defines population health as a health outcomes of a group of individuals, including the distribution of outcomes within that group. So, and I stole this little visual on the right here from the NIH website, but the idea of Virginia Hospital Center is really in line with where we're seeing healthcare go in our country right now, and that is to value-based purchasing. That's making sure our patients are getting the very best quality care, and that we're accountable to that care, not only while the patient's here hospitalized, but during that episode of care. When they return to the community, we want them to enjoy that quality of life, to realize whatever it is they want to accomplish, that they can do it with the least amount of restrictions, and that we can keep them as healthy as possible. So taking on some more ownership for our outcomes of our patients. And so our goal is to identify barriers to those outcomes and work with patients in the community to overcome those issues. And, social determinants of health is one of the popular terms to use these days. And that is something that is real. Those are the non-medical barriers to care or barriers to goal outcomes. And so when we're talking about food insecurity, housing insecurity, transportation access, just as a couple examples, we are now interviewing patients when they present to the hospital to start unpacking those challenges early. And then we are following our patients in the community for at least a month at a time to make sure that they're getting what they need. And so the why behind this, our mission is to put the healthcare needs of our patients and the community first. I mentioned our future is value-based purchasing. It's a very competitive market, which is good for patient outcomes. So the greater Washington, D.C., Northern Virginia area, no secret to anyone on this presentation today that it's a very dense healthcare market, which again, if we're all competing on the basis of quality, that's an amazing situation for our community, so that they have options to choose the very best, and it incentivizes and pushes us to be the very best. All right, you want to hit that next slide? There we go. So our team, as Cathy mentioned earlier, are led by reporting up to our Chief Medical Officer, Dr. David Lee, who's been at Virginia Hospital Center at VHC Health for a little over 30 years as well. He's an anesthesiologist. Myself, Associate Vice President of Population Health. Hannah Davis, who you're going to meet after this next slide. She is our team lead who is running the show, and she has a new team member that's actually joining us on Monday. So we're excited to start expanding that program. We have physician leadership. Dr. Manesh Nachnani is one of our co-medical directors of our hospitalist program on the inpatient side. He's been with Virginia Hospital Center for about 15 years. And then cardiology at Virginia Hospital Center is quite diverse in that we have not only our own employed cardiologists, but we have a great representation from Virginia Heart, one of the larger practices in the region, and Kaiser as well. We have pharmacy representation on our team, dietary representation, quality, and case management. And with that, I am going to let Hannah tell you exactly what it is she's doing.
Hi guys, I'm Hannah. I'm a nurse. I've been at Virginia Hospital Center, VHC Health, for the last 10 years. And I'm happy to talk to you guys about population health. So what I do on a daily basis, we're checking patients, trying to figure out who fits into our scope of practice. I'll talk about that in a little bit. But doing social determinants of health assessments, like James was talking about, and really just creating relationships with our patients. Just having someone there that they can talk to, and they feel comfortable with telling their whole life story. Sometimes my interviews on initial interviews, I mean, I'm in the room talking to patients for up to an hour and a half. We talk about all social determinants of health, so what James talked about, finances, transportation, family barriers, social or mental barriers that could keep them from making it to follow-up appointments or getting the care that they need in the outpatient realm. I tell all of the patients that it's my job within the hospital to keep them out of the hospital. So just creating that resource in the hospital for outpatient care. And the way that we do that, I call patients once a week for 4 weeks, so that's 30-day post-hospitalization. And I do pretty extensive follow-ups, do a lot of education, medication management, escalation of issues that patients may have at home. They ask a lot of questions, which is great, making sure that they're making it to their follow-up appointments. I can set up appointments for patients should they need it. And then engaging, I think one of the biggest things that I do is engaging with people like yourself on the call. So home healthcare agencies, skilled nursing facilities, patients' families, having sometimes really difficult conversations about, plan of care, progression of care, goals of care, things of that nature. So I tell everybody that my job is pretty expansive in the way that, I can be whatever you need me to be. And then if we do have readmissions, right, the goal is a reduction of readmissions, as James was touching upon, but we're never going to get to zero. So every readmission that we have, we go back and I lead a monthly meeting that we talk about all the readmissions from the program for that month. We talk about all of the social determinants of health, or what factors basically, could we have done anything better? Is there a way that we can learn and grow so that this doesn't happen in the future? And trying to find solutions for that. And I just like this little iceberg thing, because medical care is the only thing that you see at the top, but then everything else at home we have to take into account. Okay, you can go to the next slide, please. And as we touched upon, so the goal is to reduce readmissions. Right now, what we're doing, because I'm only one person and I have had close to 400 patients in 10 months, it's been great, but I'm only one person. So we're focusing right now on the Medicare, Medicaid, and uninsured population. And my background is in cardiac nursing, also with readmissions. We're looking at congestive heart failure and acute MI, so anybody that had a heart attack, stent placement, any sort of cardiac event, as their primary reason for hospitalization. And As James said, we're starting with a new team member on Monday. We're really excited to have her. And then the goal would be to expand to further disease processes like COPD and pneumonia, and then add on as we go. Whereas, you know, the ultimate goal, our 5, 10, however long it takes, year plan would be that every patient has an SDOH, a social determinants of health assessment, if they come into the hospital. Yeah. And then that's all we had. And James, unless you have anything else you want to.
Yeah, great job, Hannah. One point that you made that I want to reinforce is that everyone on this call, our partners, I call you, we can't do anything by ourselves, you know, right? So the alignment of our team members internal to the organization, but we are not looking to duplicate efforts. We have worked closely with you guys for years and continue to do so. And so I want to thank you guys for being part of the solution for our patients. And we're going to continue to reach out to you as we expand our population health program, also through the case management department, so that we can expose our patients to those amazing services you have that will add value to their lives. And I will let Fran.
That was fantastic. And just as a reminder, James and Hannah will hang out for the end of the program, and you can use the floor plan feature and double click on their office. They are going to be over to on the left-hand side of the floor plan. But now we'd like to welcome Fran Barnes, who is the Director of Case Management, and always a popular person, no matter what the occasion in senior living is, case management. So Fran, I think probably you can come to the stage if you just turn on your mic and camera, and there you are. And then
hi everybody.
Hey Fran, and then I'm gonna share the screen here for you, and I'm gonna drop off and let you take it from here.
Okay, great. Well, I want to welcome everybody and thank you for being here. I saw so many agencies that we work with, so it's really exciting. I just wish it was in person, but it's so wonderful at least to see everybody and see you here. I am the Director of Case Management. I was promoted about a year ago to Assistant Director and then Director. Dave Ogilvy is the Assistant Director. We work under James, so he still guides us as we need it. Our primary goal here at Case Management is to assure that each patient that's discharged has a safe plan, the safest possible plan. That could include home care, whether it be nursing, physical therapy, occupational therapy, speech, home health aides, whether they be private pay or Medicaid home health aides. We hook patients up with life care, Meals on Wheels, and other services like that. Sometimes people on the home care also go with hospice. So it's sometimes connecting them with a hospice inpatient unit versus hospice home care. We also do skilled nursing centers for rehab. We do long-term care nursing homes if that's needed as well. We also do acute rehab settings throughout the area. Some patients have outpatient therapy, and outpatient therapy could consist of physical therapy. It could consist of following up with county agencies for some mental health needs. We do also refer to different psychiatric units if patients need that for an inpatient stay while they're here, or even wellness and recovery units. We set up transportation, whether it be, car rides, wheelchair vans, stretchers, or ambulances. We make sure that patients are followed up medically, whether it be with their doctors or clinics. We'll refer people for Medicaid if they're eligible and help facilitate that process so they can get more services, whether it be at home or in a nursing home. We'll activate the social services, adult services if they need some extra support in the home as well, and also child services as well if that's needed. We've also referred to different shelters if people have been homeless, and we also order a bunch of DME or equipment for patients that are being discharged to help facilitate the safer plan. So within our role, we have a team of 25 case managers, and so The goal is that the patients are seen within 24 business hours of admissions to do a complete assessment to assess their needs and develop or start developing their discharge plans. The case managers have a vast knowledge base of all the different agencies and services available to the patients to facilitate their discharge plans. And in addition to the patient's assessments, we also partner with assigned caregivers and community partners to serve the needs of our community. As James said before, without you all, we couldn't exist. So we really appreciate it. And we love that you're readily available when we have patient needs, and you guys are really quick to respond. So we truly appreciate you. So if anybody wishes to contact case managers at any time, you can call 558-6275. And usually if you leave a message there, it will be forwarded to one of the case managers and we can certainly work with you. And I'm looking forward to hopefully meeting with all of you in the rooms very soon.
Well, thank you so much for that great overview. And I know Fran's room is going to be a popular one. So, okay, let me see what we got here. Okay, so now I am going to welcome some of the other VHC team members to the stage, and I'm going to do my best at doing this. And if Cathy and Kate, if you want to turn on your mic and camera and do this with me, help me pad for time as we're getting these folks up.
Sure. Any of the VHC folks who are on this list, if you want to just turn your camera on and your mic on, it
yeah,
should bring up.
I have to.
You have to add them. All right.
Yeah.
So what we wanted to do is just have each of the VHC folks that are here representing their area just say, introduce themselves and where they're from. And then if you have further questions, you can go into their room. So Chutuape, thank you. Do you want to go ahead and start off?
Yes, sure. Hi, I'm Chutuape Sood. I am one of the supervisors at the outpatient pharmacy. And basically here we do medications, we fill people's prescriptions, we do a lot of counseling with our medications. We do a whole bunch of immunizations, and also we have a blood pressure clinic where patients can check their blood pressures. So we have a whole variety of things that we do to help our medication therapy management is a big one because a lot of patients are on a ton of medication. Sometimes don't need to be on all of them. So we go over them with the patients, answer any questions. And we do a lot here. So if anybody has any questions, feel free to ask.
Great. Okay, and you can meet with Chutuape at her table. That's the outpatient pharmacy table. So Chutuape, thank you so much. And let's see, who do we have here?
Yeah, I'm going to have Brian go next. And Brian, thank you for being here because I think there's a lot. I think that our patient experience department at VHC is such a value department. And I don't think there's a lot of people that know about our patient experience department and truly what they do. So Brian, I'm going to throw it over to you.
Thanks, Cathy. Appreciate it. Yeah, so my name is Brian. I'm the director of patient experience, and there's a lot of things we have our hands on. Overall, what we do is we partner with different parts of the hospital, every department, to ensure our patients have an exceptional experience. And that's anything from doing in-services and education on compassionate communication, de-escalation, customer service recovery. I do a lot of teaching for hourly rounding with our clinical staff. And then we also, in my department, the volunteer services run through us, our interpretive services, so those patients that need language translations, people that are hard of hearing or have vision problems, we help them with that. And what else do we do? We do a lot here. But mostly, I mean, just overall, anything, we just want to be a resource to every part of the hospital to enhance the experience our patients have.
Right. So I think too, so for folks have questions for Brian, so Brian's really working with the patient experience while they're in the hospital. So if anyone has questions, or if you've had clients that have been within the hospital and you've needed services and you weren't sure how to get help, then Brian's your person to go and talk to after all of this, and he can kind of tell you how to reach out to them. I'm super excited to have Courtney here because our trauma center is something that is very new to Virginia Hospital Center in the past year. So she can give you both Justin and Courtney are both from our trauma center, and she can give you an overview, and then they'll both be here to talk in more detail of it afterward.
Thanks, Cathy. My name is Courtney Keaton. I'm with the trauma program at Virginia Hospital Center. We are a newly officially designated level 2 trauma center. So we're very excited about that. But not only do we take care of the patients while they're in the hospital, from the emergency department all the way through until they get to the rehab portion of their care, we're required to focus on injury prevention, and we do a lot of outreach in the community as well. So we are very excited to meet some of you and share what we do and some of our goals, as well as learn some of yours as well.
Great. Thank you, Courtney. So Courtney and Justin will also both be in room. So if you have questions about what it means to be a level 2 trauma center and what's required of a hospital to get that designation, please reach out to them. And then I see that Christine is she's
So
here,
we've got
but
Christine. Yep, Christine, if you want to just turn on your mic, or we got Christine, Caroline, and Maria and Meenan left on our list here. Okay. And let's see. Okay, so just if any of the folks that are, you should all be on stage and be able to pop on if you just turn on your mic and camera. But we got Christine from outpatient rehab OT, Caroline from outpatient rehab PT, Maria outpatient rehab speech, and Meenan, who is the medical doctor for the trauma center.
Yep. So while we're waiting for any of those to pop up, and they'll be in their rooms, so you can also go to separately. Before we break off, Steve, do you want to talk a little bit about the upcoming senior resource guide, or you want me to talk about it?
Yeah, here, let me just, I think I've got, let me go back to sharing my screen, and then I'm gonna, and then again, if those folks can pop on the screen, that would be great, and we'll turn it over. These are the highlighted ones, are the ones that you just met. So, but all of these folks are going to be in the resource fair. So when we go back to the floor plan, you are going to have the opportunity to meet with the organizations, in addition to all the people that you've met on stage, all the organizations that supported the senior resource guide. And this is a directory that we have been doing. Cathy, how many years has it been now?
I want to say at least 6, because 6, because I think we're on our
4th edition.
Yep. And so just for those of you who are not aware, the senior resource guide, as you can see a little picture of it here, the first part of the guide is all the services that we offer within Virginia Hospital Center. And then the other part of the guide is really resources in the in the community. So we have sections on home health, on skilled nursing, on assisted living, senior living. We have articles. It's kind of a mini version of the
Source book.
source book. And this guide is in all the lobbies of the hospital. So it is in the main lobby, the cafeteria, the 1701 lobby. I know that the folks at Arlington Neighborhood Village pass it out to their members. Arlington County, we take it to all our community events. So it's such a great, valuable tool for the members of our community. So we also have, information on need. So if your organization is not in the guidebook and you want to be in it, reach out to Steve or myself. The next issue is scheduled to go out in 2023. So we start working on it this fall. The nice thing about it is we usually print enough to last us for 2 years. So it's, once you're in there for 2 years, and every 2 years we put out another guide. But we can't stock them enough in the hospital. Kate and I are at the hospital at least twice a week.
So if you're a family or an individual, it's a great resource. But if you're an organization, it's a great way to connect with the hospital community. It looks like Christine is having some tech difficulties, so we can definitely make sure that you connect with her in her room, and that is Christine Crawford. But she says that we work as a team to address patient needs with regard to safe and independent living. Our goal is to establish and restore functional independence, whether the patient has experienced a knee, hip surgery, arthritis, chronic disease, or notice a change in cognition, speech, or memory. We have multiple specialty areas such as pelvic health, vestibular, and balance, as well as hand therapy. Wow. We are happy to answer any questions you may have and look forward to meeting you. So,
and I just want to also mention that Christine also coordinates our stroke survivor group, which we do have. We have a stroke survivor group, and Christine coordinates that as well for the hospital.
Well, Cathy, I'm looking at the clock, and I know that we did a pretty good job of getting close to the time that we wanted to get folks back to the floor plan. I'm going to just do a quick share of that floor plan for everyone. So this is what's going to happen. We're going to go back to the floor plan. This is just imagine you're at a wedding and you can go around and talk to anybody that you like. But the exciting thing is everybody you met on stage and the resource guide folks are there, and you can interact with them. And we're going to leave this thing open till 1:30, so you can hang out as little as long as you can. Just a reminder, I'm going to go sit at the table in the lower right-hand corner. So track me down if you got any problems. But remember to turn your mic and camera on, and you just double click on any chair, or if your screen says join, you can go around, pretend like you're a bride at a wedding, go around and meet somebody at every table. The panel members are on that left-hand side of the screen that you see there, these offices. That's where you can talk to the panel members. The first 2 rows is where you'll see most of the VHC team members, and then the remaining rows are where you're going to see the senior resource guide vendors that I've got up on the screen here. Arlington Neighborhood Village, At Home in Alexandria, Chesterbrook, Elder Nourish, Georgetown Home Care, Goodwin Living, Life Care Affordability Plan, Lionheart Elder Care, Mount Vernon at Home, Nursing Referral Service, Right at Home, Sencura, Silverado, and Sunrise Senior Living. Oh, and I know Overwhelmed, How Can You Help? She came in at the last minute. There might be some other folks from the Senior Resource Guide that are out there. But folks, thanks for your patience with this new technology. Thank you, VHC, for everything. Have a blast on the floor plan. I mean, on the in the expo hall, and make sure to email me. I'd love to know your thoughts on this. We're trying to create new opportunities by using technology and other things, and I'm pleased that VHC Health is partnering with us on this opportunity. So here we go. Oh, and back, present off. There we go. Back to a floor plan.